agencies. Department of Public Health Commissioner Giussani, Department of Emergency Services and Public Protection Deputy Commissioner Bergeron, Department of Consumer Protection Commissioner Siegel, Joshanda Greer from the Department of Children and Families, as well as all of the members of the legislature. And Demas's statewide providers, advocates, partners, all who fight back against stigma and the scourge of overdose deaths Connecticut and the nation is facing. Today, on International Overdose Awareness Day, we stand in unity and remembrance to honor those who have lost their lives to an overdose and acknowledge the grief that is felt by family, friends, and communities. The news of each death associated with overdose is devastating. Every time I walk into our offices here in Hartford, literally when the elevators open on the fourth floor of our building, there is the remembrance quilt that folks have put together. It's the first thing I see as I walk into my office suite. It's prominently displayed in our lobby, and I see the faces taken by this disease that does not discriminate. Too often taken by a drug that is so lethal, a few grains can be deadly. I read the names and the messages of love. They stay with me as we continue this fight, and it drives all of us to try harder to find ways to end this crisis. Make no mistake, the numbers are staggering. Last year, we lost 1,531 people in Connecticut to overdoses. These people are our brothers, our sisters, our mothers, our fathers, our friends, and our neighbors. While fentanyl remains the most common drug involved in overdose fatalities, we also saw the emergence of xylazine and fentanyl analogs. As these numbers have continued to climb, it is also important that everyone knows about and has access to the life-saving opioid antagonists, or what we know as naloxone. Demas is on track to reach the goal of distributing over 45,000 Narcan kits throughout Connecticut, with the hope that meeting and exceeding this goal will significantly reduce opioid overdose fatalities. Today's events emphasize the continued need for awareness and education at the community level, which we continue to promote through our Live Loud campaign and Change the Script campaigns. Demas also continues to aggressively pursue resources to address this crisis. Over the past 6 years, we have applied for and secured over $60 million in federal funding to expand initiatives that are critically important to confronting the opioid addiction. The settlements with the pharmaceutical industry, led by Attorney General Hong's office under the guidance of Governor Lamont, will provide substantial funding for much-needed prevention, treatment, and recovery supports locally, regionally, and statewide. In addition to prioritizing the distribution of naloxone, Demas has increased outreach and engagements to individuals who are actively using opioids. Recovery supports, low barrier treatment, medication-assisted treatment are widely available in Connecticut. Same-day access is available at many outpatient clinics or through the mobile vans that you see here today. Connecticut is embracing a harm reduction approach, hoping that a saved life is a person with another day to find a path to recovery. Recovery coaches in every emergency department in the state link people with drug-related and medical emergencies to treatment and recovery supports. And I think we are the only state that has reached that achievement of having a recovery coach in each and every emergency department. Community models, some through local ministries, have engaged individuals in the especially hard-hit Black and Hispanic communities, using trusted messengers, community messengers, to break down stigma and to share information and resources for help. It is heartbreaking to know that while we tirelessly continue to fight this battle, lives are lost each and every day. And yet knowing that through your efforts, everyone that is here, every day someone, maybe someone that you love, is revived or connects with recovery. That is the reason we keep on. it is heartening to see so many Connecticut residents observing this important day through community events sponsored across the state. We know it will take the collective efforts of all of us to turn the tide on this epidemic here in Connecticut and throughout the country. You may know someone who has died of an overdose or someone who is battling substance use disorder, or you yourself may have battled addiction. Every single person here today has been impacted by this crisis in some way. We can all play a part in eradicating stigma and helping to prevent addiction and devastating loss. Talk to your kids early and often about the dangers of alcohol and drugs. Safely store medication and dispose of any unused or unwanted medication to keep it out of the wrong hands. Spread the word about fentanyl, the poison in the street drugs. Learn how to use naloxone and keep it on hand in the event of an overdose. And stop the stigma. Too often people don't come forward for help because they're afraid of what their families and loved ones will think. Let them know that you understand and that addiction is an illness, and you are there to support them on their journey to heal and to recover. Today, as we remember those we have lost, we celebrate those who are living proof that recovery is possible. We have a personal and collective responsibility to play a role in paving the many pathways to recovery. Thank you all for your commitment to keeping our communities healthy and safe. And now it is my honor to introduce Fiona Bureen, who is a parent of someone who was lost to this crisis. So thank you, Fiona.
Good afternoon. My name is Fiona Cullinan-Perrine. I am the co-founder and president of For Cameron. Today I represent countless families who have lost a loved one to the opioid epidemic. In 2018, I lost my son to fentanyl poisoning. Cameron bought what he thought was a prescription OxyContin pill, but that pill, stamped with the OxyContin logo, was 11,000 micrograms of pure, illicitly manufactured fentanyl. That is 9,000 micrograms over the fatal dosage. Cameron didn't stand a chance. We found him when he didn't come out of his bedroom for dinner, and it was too late. It was also our first time hearing about dangerous counterfeit pills. In the days following Cameron's death, the stigma and the lack of support we encountered was devastating. Cameron deserved more. All victims to this epidemic deserve more. This is what motivated us to speak out as often as possible, to educate on the overwhelming stigma surrounding drug addiction. Our country, me personally, and more importantly, the state of Connecticut, have been laid to the table on this issue. But we are all at the table now. From our leaders to our mental health professionals, to the countless numbers of those who have lost a loved one, rest assured, we are in this fight together. If we followed the COVID model and had regular reporting from our leaders and the press on the fatal and non-fatal overdoses each month, we would begin to understand the public health crisis that it is. We can no longer assume our children are safe if they are not actively facing addiction. It is entirely up to us. We must familiarize ourselves with what addiction looks like. We must learn the warning signs of an overdose. We must speak out. We all must speak out. We must ask questions. We must confront the stigma. Drug overdoses do not discriminate. And now it is my honor to introduce Governor Ned Lamont.
Well, Fiona, this is International Overdose Awareness Day, but you don't need a reminder. And I don't think any of the people here necessarily need a reminder. There's a lot of friends and family and sons and daughters reflected in those 1,538 flags. The 31 flags. They represent somebody who died due to fentanyl overdose over 2021. I'm here in front of me. I have folks, recovery coaches, and others who are there helping every day. You don't need a reminder, but we all do need a reminder that we got to do more. These are 1,531 of our brothers and sisters who ought to be with us today. I can tell you, as governor, what we're trying to do. You can see the mix of people standing here with me. You know, Nancy, mental health, what she's done in terms of making sure we do have a recovery coach in every one of our emergency rooms, what that means going forward. And Manisha and the Department of Public Health and Live Loud and reminding people there's no stigma. You know, we went through COVID hell for 3 years. I saw those numbers spike up. I saw it unleashed a lot of wounds or uncovered a lot of wounds. And a lot of those wounds were reflected in a variety of different behaviors, but addiction and the illegal pills and crime that were related to that. We're doing everything we can to make sure you know you can come, you can get help, and you get help without judgment. We need to be able to do that. Michelle Siegel here from Consumer Protection, somewhere, just reminded me she's got the pill recovery boxes, 100 of them around the state. So you don't leave a lot of prescription pills sitting around in your bathroom. She's recovered last year 50,000 pounds, 50,000 pounds of prescription pills that were dropped off here. Imagine how many tens of millions of pills that is and what that could mean. There's treatment, there's prevention. We're doing everything we can in order to be there for each and every one of your loved ones. And what that means, I'm here with Senator Blumenthal and our amazing federal delegation, what they've done in terms of investments in mental health. If Charlene Russell Tucker was here, we have mental health clinics and health clinics in almost all of our schools, and doing everything we can to head off early and make sure that each and every one of your loved ones has the care and love they need. This is about respect. This is about love. This is about understanding and making sure people know they can come and have a safe place. And on the other side is enforcement. And you got to be strict here. And nobody has been stricter than Attorney General William Tong. We're going hard. He's going hard right after those corporate entities that were pushing these drugs. And also and we got 400 million plus in settlement. He'll tell you that settlement money's already beginning to come in. And you see that reflected in recovery coaches. You see that reflected in a lot of the other initiatives we have. And we got to go after the gangs and those others that, Fiona, manufactured those counterfeit pills that resulted in the death of your son. And to me, when you do that, selling those pills, pushing those pills, it's like a murder weapon. And I think those folks should be treated accordingly. But that said, we're here on behalf of the 1,531 people that are no longer with us, reflected in these flags, and making sure that next year they're fewer, and the year after that they're fewer. And we can't do it without each and every one of you. God bless you. Thank you. Without further ado, Senator Blumenthal.
The governor was going to give me an elaborate and gracious introduction. Just to begin where he finished, those 1,531 flags, every one of them is a human being. Every one of them had a precious life and family and loved ones, friends, a future that has been lost. And that loss is all of our loss. Law enforcement is absolutely necessary here. We need to stop the flood of fentanyl coming across our borders, fueled by ingredients from China and other countries. We need to stop the deluge of now xylazine and all of the drugs that corrupt prescription medicine. And law enforcement is necessary, but we're not going to arrest our way out of this crisis. We're not going to prosecute our way out of substance abuse disorder. As necessary it is, it's not a panacea. And removing the stigma is absolutely essential. That's what you're helping to do by being here and by speaking out and living out loud. But we also need to recognize the elephant in the room: social media, digital platforms. Go to those platforms right now, and you'll find the emoji, the slang words, the marketing, the advertising. It's not find fentanyl here, but social media, some of the big tech companies are complicit, and they need to be held accountable. That's why I've introduced the Kids Online Safety Act, which will hold them accountable. And it was reported unanimously out of the Commerce Committee, but we need a vote by the Senate. We need new laws that give us tools, give parents tools, the ability to protect their kids. And we need to recognize the importance of investing more in mental health. Mental health. This country is, in my view, going through a mental health crisis that resulted from COVID. The fear, anxiety, and anger, all of these emotions that are overpowering people now are in part the cause for the surging numbers in overdoses and opioid addiction. And so I'll be announcing later today an earmark, $1.2 million for the community mental health affiliates in New Britain for a crisis respite center. Our hospitals are overcome with the numbers of cases that come to them. People who need more than Narcan, they need treatment, mental health, and care. Crisis respite centers can provide an essential link to that initial treatment and longer term care. We need to be innovative, but most important, resolute, that we will make a difference and invest in these kinds of treatment and care. I don't need a reminder, nor does anyone here, but neither should anyone in this country, because we've all been touched. We have all been impacted in one way or another by this crisis. Anybody who and begin to turn back this flow of fentanyl coming across the border and mental health crisis in this country. And if you need any alarm bell, just read the report today. Life expectancy in the United States of America has dropped more drastically over 2 years than at any other time in our history. Across all demographics, life expectancy is dropping in supposedly the greatest country in the history of the world, and it is the greatest country in the history of the world. And we cannot allow this kind of public health crisis to continue. And it affects most direly communities of color. There is an equity issue here, and we can't look away. One of the most staunch and effective advocates for public health has been our public health commissioner, and I'm proud to introduce her now, Commissioner Giussani.
Thank you, Senator Blumenthal, and I'm honored that you actually brought my stool for me over. Thank you for that. This is a very humbling day, and COVID has taken so much from all of us. We've seen that most importantly over these last 2.5 years. But for people who have been suffering with a medical condition of addiction, and families who have suffered the consequences of overdose, COVID pales in some ways to what has been going on for so long. In 2012, we had 357 overdose deaths in the state of Connecticut. You've heard this number of 1,531. Over the last 10 years, the number has gone up fivefold. If that doesn't strike you, I don't know what would. You heard about xylazine from Commissioner Navarrete. That is an animal tranquilizer. Fentanyl, contaminating the supply. People not knowing, as you heard from Fiona, that they are taking something that is going to be so dramatically toxic to them. The stories are endless. The pain is immeasurable, and we have to do more. What are we doing right now? You've heard a lot about initiatives that are ongoing. Of course, we want to try to prevent usage in the first place. We have partners at UConn and other pain centers that are trying to treat pain appropriately to start, so people don't go down the road of opioids. We've got an app, our Nora app. There's a table over there from DPH, naloxone and opioid reduction app. And you can learn about how to use Narcan. What are the signs of addiction and overdose? And this is a tool that people can use to be able to be a help to your community and for loved ones that may be in your household. 50 to 60% of overdoses that occur have a family member or friend, some sort of bystander that's around. And if everybody could be trained on how to use Narcan, and we had Narcan all over the state in the hands of people who could help save their loved ones, how much further could we go? This app is a way to help educate people on things that they can do that are in their hands to help save their loved ones. I know we have more to do. We're fortunate to have the governor, the senator, and all of our other leaders that are behind us in this fight together with us to protect our public's health. There are children in our state that through COVID, 10, I believe, in the last year, who died because they got into a family member's stash. Fentanyl overdose in a child because they mistakenly took or touched or did something where they didn't even know what they were accessing. We have to do better to take care of our community. And I will do what I can in my role as Commissioner of the Department of Public Health to do better in the years ahead. Thank you.
Is there any chance we could get ibogaine legalized or descheduled off the Schedule 1 center? The life-saving plant knocks out an opiate addiction in
Good
8
afternoon.
hours.
My name is
Share.
Dershonda Gurrier, and I'm the Department of Children and Families Administrator for the Clinical and Community Consultation and Support Services Division. On behalf of Commissioner Vanessa Durantes, I am honored to speak to you today and reinforce the department's continued commitment to providing access to timely and family-centered services and support for those suffering from opioid and other forms of addiction. Children are our most vulnerable asset in society. As we cherish them, we also know their world can be unpredictable given the nature of caregiver substance misuse. Children deserve our collective efforts to help ensure that they grow up safely in their own homes. The strength of Connecticut is evidenced today by all of the leaders across the state, to my left and to my right, who come together on behalf of Connecticut's children, their caregivers, and our families in our communities. We are haunted and humbled at the daunting task that is before all of us. Annually, the Department of Children and Families serves 13,000 unique families. Parental substance use is a risk factor in 70% of our reports. Just last week, our agency received a report of a father who overdosed and died while his two young children were in the home. Those children will now grow up without a father, seeing them live through life's milestones, like going to their first dance, riding a bike, hitting a baseball, attending any event that is that are many events, if you will, that happens up to and through adulthood. Those children will, like many of our other children, did not ask to be in this fraternity that we call lost, nor did their extended family. No child can imagine a life without his mother or his father. A week prior, our department became involved with two brothers who were unable to wake their mother. And upon arrival of the police, a heroin overdose was found to be the cause of her death. This week, those children went to school for the very first time without their mother bringing them to the bus. She'll never attend an open house again, make their lunch, or give them a hug at the end of the day. When those teachers ask, "How was your summer?" did the trauma of their loss only resurface? Each of the flags that you see planted across the lawn today represent a life lost, leaving behind a mourning family and community. Those we miss, as Commissioner Navarrete said earlier, are our mothers, our fathers, sons, daughters, brothers, sisters. This year, we have said goodbye to almost 700 individuals and over 1,500 more last year that were taken due to drug overdoses. These individuals are not those people, not those over there. They are right here in front of all of us. They're our colleagues, our friends, our neighbors. Each of those individuals who left us leaves a legacy. It is our job to keep their legacy in the forefront of minds. We are grateful for the ongoing support and collaboration of the Office of the Governor, Ned Lamont, Lieutenant Governor Susan Bowitz, our sister state agencies, and the Connecticut Legislature, allowing DCF to have the resources to strengthen and empower families across Connecticut in partnership with our fellow commissioner for the Department of Mental Health and Addiction Services. My commissioner works tireless to provide family-centered and individualized treatment services for those afflicted by substance disorder. Together, they co-chair the Alcohol and Drug Policy Council. So this council will continue to work to improve the child and adult serving systems across the state. Both commissioners are motivated by family voice, as you all are the experts to help us improve our system. So in closing, our 2022 legislative session was historic. In bipartisan fashion, statutes were passed and funding was approved to ensure the behavioral health needs of children and the supports of their families required are provided. They included increasing the capacity of our evidence-based programs, including in-home substance abuse treatment, mental health, and parenting services, expanding 24/7 emergency mobile psychiatric services for children and adults, development of a mental and behavioral health and substance abuse screening tool for pediatricians and emergency room doctors, expansion of behavioral health consultation and care coordination for primary care providers, and incentives to hire and retain behavioral health professionals at all levels and disciplines. This gives us hope about tomorrow and the future of Connecticut's children and families. In Connecticut, when you ask, we respond. The first step in support is lifting the stigma and shame attached to those afflicted with substance use disorders. We must continue to work tirelessly to change the narrative associated with substance abuse and realize that asking for help is a strength and not a weakness. To our families, we stand right here beside you in this fight. To our children, we are here for you. Thank you. And next, we will hear from Attorney General William Thone.
Good afternoon. Let me invite Chris